Back, everybody. WAJR's Ask the Experts continues. Tony Caridi along with HealthWorks' Jordan Feathers and Dr. Brendan Balcik of WVU Medicine. You may see these guys in the area. They are frequent. In fact, Dr. Balcik has the best seat at the WVU Coliseum next to the head coach. I mean, other than Bob Huggins, my man is right behind that Mountaineer bench. He is one of the WVU team physicians, and we're talking about pain management here today. And I guess, Dr. Balcik, on a typical day for you when you're dealing with the athletes, it can be an acute thing where they go up for something and all of a sudden they see that they got injured, or all of a sudden they wake and they say, oh, I've got a problem here. One of the big terms that we hear a lot, not only in sport, but in everyday life when people are dealing with a pain issue, is MRI. If you could, when is that needed? When is that necessary? And is it always a necessary element of trying to figure out where pain's coming from?
That's a great question. I think, MRI is something everybody wants, but you've kind of alluded to it. It's not anything that, everybody needs. I think it has its purposes, especially in the acute injury, say, for example, a knee, if you're worried about an ACL rupture or an acute meniscus tear. Certainly it's warranted at that time, but somebody who comes in with vague knee pain that's just kind of been smoldering for months and months, that patient doesn't need an MRI, at least not initially. It may be something that can be broached down the road, but nothing that's needs to be done immediately.
Yeah. When do you guys oftentimes say, yeah, green light, go ahead and let's do an MRI? When does that come about?
I would say that in my experience, what we see is if we get a referral from a physician, we've seen that patient for 4 to 6 weeks, we've exhausted a good bit of our opportunities of trying to help with their pain symptoms and function. And that's another part of that is maybe their pain isn't completely gone, but their function has gotten better. But if we're not seeing the general improvement that we would typically see in that time frame, we refer back to the physician. At that point, the physician may elect to do another diagnostic study because we've tried the things that we know work day in and day out. If someone's not responding to those, that's a pretty good indication that there might be some more significant tissue damage that's been going on.
As we said in our first segment, these two gentlemen represent the same field, but through oftentimes different modes. And so from Jordan's perspective, their modalities oftentimes are, ice and machines and STEM, which is an electrical current, and all different kinds of things that we've talked about numerous times on this program. On the other side, as a doctor, you not only have access to those types of things, but medication as well. And obviously, our state and the nation is dealing with a tremendous problem as the opioid epidemic has blossomed into a whole world that no one had ever thought about. When and when not, how do you break this down, Dr. Balcik, when it comes to pain management?
I think we try to avoid opioids as a whole these days. I think the addictive properties are a problem, as everybody is well aware of now. So as often as possible, I try to do just simple NSAIDs, whether that's ibuprofen or naproxen. Those type of medications can be very, very helpful. What I tell people is, though, you need to take them on a scheduled basis, because sometimes if you just take them as needed, that effect is not as much as you would get as if you were scheduled.
Really good point. So let's get into that a little bit. It's a great point, right? Mm-hmm. It's just not a one-off, is it? So if someone is dealing with, let's just point to whatever joint you want to. You want to go hip, you want to go knee, you want to go elbow, whatever it is. Walk me through, if you would, how the medicine works if you are taking an anti-inflammatory and why it is needed to be effective that you have to stay on a schedule. What happens physiologically?
Sure. The anti-inflammatory meds are targeted at the inflammatory mediators, which basically when the body's injured or there's soft tissue damage, the body fixes it by sending more stuff there. So the different NSAIDs will block some of those pathways. And what it does is it helps relieve some of that inflammation, which helps with the pain so that the patient can then go through physical therapy, do the exercises they need to do to help them long term.
Yeah, makes sense. Jordan, from your perspective, let's say that you do get a referral from Dr. Balcik, and he says, I've got someone here that's dealing with whatever it is, whatever type of element we want to use here, a back or whatever. Can you kind of give us the normal procedure once they come in for treatment at HealthWorks? How does it work? How long does it last?
Yeah, very similar to what Dr. Balcik mentioned earlier. Was we do a history when someone comes in. They tell us about their pain symptoms, how long they've lasted. Was there a mechanism? Have they seen someone? Have they seen a physician? Have they had x-rays? Were they given medication? Are they taking that medication? And we can be helpful to reinforce that. The doctor said you need to take this 3 times a day. How many times are you taking it? Well, I take it when I need to. No, you need to take it 3 times a day. Let's get in that routine of doing that. You'll be able to tolerate the treatment better. We also do our physical exam. Usually when we identify the area of pain, we try and target that right away so that they can get into the more functional stretching and strengthening type exercises that our therapists will tailor to that body part and to that injury. We also make it functional, something that they can do throughout their day to help with their pain symptoms. Sometimes it's as simple as sitting up straighter at your desk or changing the position of your monitor so your neck doesn't hurt.
Mm-hmm.
But we're going to give you real world, firsthand knowledge that you can change something right away, immediately, that same day to help with your pain symptoms.
I'll ask both of you guys this. What's the biggest thing that frustrates you when it comes to patients that they don't do, that if they did, they could improve themselves? Is it medication that they don't properly take?
I think it's just being compliant with the plan, whether it's actually going to your physical therapy appointments or if you've been set up to do home exercises, actually doing them at home, I think is the biggest issue.
I would echo that. I mean, if someone comes back and tells us that they haven't been feeling better after their first or second appointment, are you going through the exercises as we describe them? Are you doing them regularly? Are you icing? Are you taking your medication? Being compliant is really the biggest thing. We might see you 2 or 3 times a week max for possibly an hour at a time. There's a whole lot of hours in the week that you've got to be working on it on your own.
Absolutely. Jordan Feathers is with us from HealthWorks Rehab and Fitness, representing WVU Medicine as Dr. Brendan Balcik. We're talking pain management. We'll wrap things up. More details for you coming up. This edition of Ask the Experts is being brought to you by HealthWorks Rehab and